good. Okay.
Probably what you want to eat?
Yeah, finish.
It's
You
done.
finished?
Yes.
I'm gonna move it out of the way.
Okay.
Maybe you can go get some real food when you leave here. Are you the one I talked to on the phone?
Yep, yep. And with my sister.
Oh yeah. Yeah, it takes them a while to make this stuff.
It's okay. It's okay.
They make it when they make a bag. It's 3 days. It's a 3-day bag, and it takes like a whole bunch of vials. It takes forever to mix. So, do y'all live together?
He's living with my sister, and I'm not. So.
Close?
Yeah.
Are you close by?
Yeah. Yeah.
Okay. Probably the so. Are you going to? How do y'all plan on doing this? Working with each other when you. So he'll have to change the bag on Monday. That's 3 days. Are you going to be there, or are you just going to do it to yourself, or do you know yet?
You first together with me. I'll see what he's doing.
Okay.
What he picks, and then that one.
Okay, I'm going to do it as if he's going to do it himself.
Yeah.
So he can be confident.
Yes, that's the plan. I mean, if he can do it himself, better. Yeah.
Perfect. I'm going to unhook you from that, and then I want you to wash your hands, okay? Let me wash first.
And if you don't mind, I will be recording so I can give this to my sister
That's
because
fine. Mainly how to do the pump,
Yes, yeah.
but it's only like 3 or 4 buttons. But
Ah,
it'll
okay.
be easy. But the problem is 3 days from now, people don't always remember, so it's good to record
Yes,
it.
yeah, right.
Stop this. Where we at here? Let's see. All right. I don't like all this. I don't like it when it's messy like this.
Change this one.
This tape,
I know.
this tape will peel this other tape off.
Yeah.
It's not made to last. Sorry, I hope I didn't peach your skin. This is made to last a week,
Yeah.
but this is not.
Okay, yeah.
All right, wash your hands for me. Soap and water.
Kapag hugas ito. Hugas. Soap ha, with soap.
You have a knife?
Here. This one. Yeah, so it's got like a small version of this one. Ah, okay.
Is this his to take home?
I know, we can figure it out. Yeah, so this one.
That should be enough room. Okay, your medicine will be, when they ship it to you, it comes in this bag, so you will put this bag in the refrigerator. You have 2 more bags in here.
Yeah.
So when you get home, refrigeration.
Yes.
Okay.
It will. They ship it in this
Maybe how many days this one?
3.
3 days.
They ship it in this bag that has ice packs in it.
Yes.
Yeah.
You can throw it away.
Okay. Okay. So the important there is the brown one. Yep. The brown package. Okay.
Yes. Yeah.
Okay.
Just leave it in the brown package. I think they like to protect it from light and all
Okay.
that.
Okay.
I'm going to show you what they put in this box first.
Mhm.
These are saline flushes. These are heparin flushes. You won't need them. The nurses usually use them when they
Yeah, okay.
draw blood and things like
Okay.
that. But they're in your box.
Okay.
This you will use is alcohol. We only need a
For
couple.
cleaning.
Yep. We only need 2 for now. Okay.
Okay.
About. But you got a whole box. I can never pack this thing up how they pack it.
Yeah, it's fine.
These pumps, I'll show you, but they have batteries. They give you a whole pack of batteries.
Mhm.
Yeah.
Ah, okay. Yeah.
That only in natin.
In this bag, you won't really use anything in here, I don't think, but just showing you, this is a dressing kit for the nurses to change this.
This one.
Mhm.
They're supposed to change it once a week,
Once a week. Okay.
but it's in here.
Okay.
The only thing you may need in here is this, when yours wears out.
Ah, okay, that one. Okay, okay. So the nurse will visit, will go to the house and do some
Yeah, they'll either go to the house or they'll ask you to come
ah,
to the infusion suite. They
Okay.
usually call you and let you know.
okay,
Our
okay.
infusion suite's over here though in Huntsville. It's about
Okay.
a mile away.
Okay, okay.
Is that possible for y'all to make it there once a week?
Yes,
If you
yeah,
need
yeah,
to?
Yep. Mm.
Okay, they may ask you to do that.
Okay.
If you do come all the way there, bring a fresh bag.
Mm-hmm.
Okay, a new bag from your refrigerator.
Mhm, yes,
You'll
yes,
have he'll have this bag connected.
Yes,
but bring a
but
new
bring
one.
a new one.
Yeah, yeah.
Okay, okay.
Now, they give you what I do with it. They give you 2 pumps.
Mm-hmm.
Okay. You have 2 pumps.
Mm-hmm.
The reason you have 2 pumps, in case one of them fails while you're at home doing this therapy.
Mm-hmm.
If one of them fails, usually the pharmacist is, if it fails, it's never during operating hours. It takes a while for a pharmacist to make a new pump and send it to you. So they tell you to go to the backup pump.
Okay.
Does that
okay.
make sense?
Yep, yep, yep.
So it's just a backup.
Yes.
Now, when you change the bag, the next bag on Monday, so you're using this bag and that pump, Monday comes around, you get a new bag of medicine, change the pumps.
Mm-hmm.
You just swap, rotate them every time you change the bag.
Every time change. Okay,
Every
okay.
time.
Yeah.
That way we know both of the pumps are always working.
Working.
Yeah.
What
Yep.
we used to didn't do that. We used to just say just use whichever one you want, and people would use the same pump, and then something would happen to that pump.
Yep, yep, yep.
And they say, oh, we say, oh, use the backup, and then they try the backup, and it's not working.
Yeah, right, right.
So now
right.
we know they're both working if you just
Yes.
rotate them.
Rotate them.
And that way, if something's wrong with one, you can tell us right away.
Yes, right,
All right.
right.
So, whatever you do, don't throw away these things here.
Mm-hmm.
These are not ours. We rent them from a company, and then we rent it to you, basically.
Okay.
This part of the pump, well, that's the plug.
Mhm.
Okay. It doesn't have to be plugged in all the time, but if you do, that's the plug on the bottom. You see that little notch there?
Yes.
It goes in that little notch
Like that.
there.
Mm-hmm.
We only go that way, yeah.
Okay.
People will often, and it's pretty tough, they give them back to us, and this is always broken.
Mm.
I think because they do it in the dark, they just,
Yeah.
And they break it.
Yeah.
the batteries
Mm-hmm.
are back here.
Mm-hmm. Okay.
So, but
It will work. You don't have to plug it in. It'll work on the batteries, but the pump, it does run out of batteries
Okay.
at some time.
Okay. And there's extra batteries also, right?
That whole box.
Yeah.
yes.
Yep. Okay.
This here this is a C clamp, and this is the pump holder. If you decide to use a pole,
Use this one.
this goes on the pole.
Yes.
Yep. And this sets in here. How's it go? I got it upside down. And then the pump goes in there.
Okay.
And then you tighten that.
Yep. Okay.
But we set it up where you can use this bag and you don't ever have to use the pole. Your pole's
Okay.
in here.
So there's an option. Okay.
Yeah.
Okay.
Most people don't use the pole, but it's there if you want. What a
Yeah,
lot of
yeah.
people will do is put the pole by their bed, and then they'll just hang the bag on the pole when they go to bed at night.
Okay.
But you don't even have to do that. You can lay it on the nightstand.
Yeah. So that depends like on the comfortability of the patient, whether he goes with the bag or the pole.
Correct.
Okay.
Alright, so I'm going to put this in your extra pump back in the bag. The box, let's just say.
How can to use this
We need-
switch? How can I switch? How can I switch this pump?
Oh yeah, later.
This one also
Switch it.
if they put this pump is automatically work this one. Or
If it breaks or,
Yeah.
or all, I'll teach you that. I'll show you.
Later na
I'm about to show you.
Yan, lahat ng instruction.
I think that's it. Yeah.
Ay, sa pag-una.
So you only need 3 things when you do a new bag. A bag, some alcohol,
Okay.
and a pump.
Okay.
Okay, I won't count that bag.
Okay.
When you take the bag out of the refrigerator,
yes,
always make sure it's your name.
yes,
Don't use it if it's not your name.
yes.
The expiration date is somewhere down here on the bottom. Discard after. So it gives you a date that says June 8th, 2026. So you can always use this bag up until June 9th. You can hang it on the 8th, but you can't hang it on the 9th.
Yep.
Make
Correct.
sense? All right.
Does the other bags also have the same date or it's
Yeah.
different? Okay.
Yeah, these will have the same days.
Okay.
So
Because
what is that? That's 9. Today's what? 28.
29.
Today's 29. So we got 30, 31, 1, 2, 3, 4, 5, 6, 7, 8. 10 days. worth.
Exactly.
Yeah.
Okay. Because each bag would roughly 3 days.
Roughly
Okay.
3 days, yeah,
Okay.
yeah.
Okay.
All right. What I'm going to teach you. This is. You remember you and I practiced
Yes.
connecting the tubing.
Yes.
That's this part.
Yes.
So what I'm going to teach you
Yes.
is to open this pump, put the tubing in it.
What is that?
I'll show you. I'll show you.
Yeah,
We're gonna put the tubing in the pump.
Yes,
You're gonna clean your IV. You're gonna hook it up,
yes,
and then we're gonna press some buttons and go. That's what we're about to learn. Okay.
Mm-hmm.
The most important thing when doing this is being clean.
clean.
This is your biggest risk. Okay. This goes all the way to your heart. You don't want to introduce a bacteria in here into your body.
Yes.
Always wash your hands, soap and water, dry with paper towels when you handle your IV line. Okay.
Yeah.
Okay.
Okay. All right. So,
Oh, cool. Okay.
all right. Let's get started. Just tear this paper off and stretch out your tubing. You tear that off. Be rough with it. There you go. All right. Yep. And stretch it out. Are you a fisherman, Mr. De La Luna? Do you
Yes.
fish?
Soon he'll be.
Soon
with
he
this,
will be.
with this.
Well, like your fishing line, you don't want it tangled up.
Okay.
Okay, very good. This is the end that will connect to you. Now, before wait.
Yan, napanto. Don't get too excited. Wait for instruction.
Now, we're gonna put it in here first. You have a yellow
Yeah.
key and a blue key. I don't know what they're called, so what I call them keys. Blue
Mhm,
key and yellow key.
Mhm.
That's what's going to go in this pump, okay?
Okay.
So let's open this pump. Put your finger in here. And then pull up. There you go. The yellow key and the blue key. This pump is kind of a bad design. You see the yellow arrow,
Yes.
Mm.
blue arrow?
Yes.
Mm.
So the blue key goes in that square.
Mhm.
The yellow
Yellow
key
key.
goes in this square. Let's do it like that. You grab the blue and the yellow key.
Yes.
Ganiti.
Yes.
Yellow,
Yellow
blue.
key. Yellow key. What is blue? Like this. Like this.
And it just sets in there. It doesn't snap or anything. It just barely goes in there. You got it. That's it.
Okay.
There's a blue key.
And you can turn this if you need to. There you go. That part's a little tricky. You want to come over here so you can film it?
Okay.
You got it?
Yeah. Like it.
Oh man, you're fast. Oh, very good. Yeah, you did. It's good. You got it. It doesn't snap. It won't. You know, you almost have to hold it in there. Now, when you close this, I want to show you something. If you close it like this,
Yeah.
it will break the tubing.
Break the tube.
It has to
It
be
will break.
outside.
Has to be in that little notch right there.
Yeah, that space.
That's right. You do it.
Like this.
Yes, sir.
Mm-hmm.
Yep,
Little
and then
snap
close your
like
arm.
this.
Yep.
Okay.
Perfect. I think. Yep, very good. You did it. That's how you load the tubing.
Mm-hmm.
Blue key, yellow key.
Mm-hmm.
All right, now. This. Do you remember how we did it earlier?
Yeah.
How you twisted it on?
Yes.
All right. You have to have 3 hands to be a nurse, okay?
Yes.
What you're going to do, you're going to
Okay.
take this alcohol,
Clean this one.
you're going to clean, actually, let me step back.
Yes.
You're going to take this, you're going to put it in your hand like a cigarette.
Yes.
You're going to open this. So now it's open. Don't touch it on anything.
Mm. Once it's open.
Once it's
While
open,
it's open.
that's
Okay.
why I have you hold it like a cigarette.
Mm-hmm.
So you're holding it like a cigarette.
Clean. this
Clean, at least 15 seconds. Scrub it like it's got mud on it.
Mm-hmm.
Drop it,
one And put this
connect.
Mm-hmm.
Okay.
Make sure not to touch the blue. Yeah. Oh,
Yes,
yep,
correct.
Yep.
You ready?
Ready.
So take the cap off, open the alcohol, clean the IV line, twist it on.
Yes.
Okay.
All right, do this first.
Make sure not to. Oops.
Take that little blue right there off. No,
Oh.
that.
This one.
Not this.
The
that.
blue one, brother.
Okay. Cigarette.
Mm.
Yeah, maybe on the back. There you go. You know what? Before you
Yeah,
do
you
that,
can.
can you wait 1 second?
Wait,
I'm gonna
wait
make
for the-
this
wait,
easier
wait
for
for
you.
the-
Just hold what you got. Take a time out. Don't let that touch anything.
Ayun na
Let me make this easy.
nag-ilabti ha.
He's not gonna be. If he's gonna do it by himself, he needs an extension. 1 second. 1 second. Let me make this easy. You can't do this one-handed. 1 second. Almost forgot.
It's okay. Take your time.
Most people, when they do this, they put Hickmans in their chest, and you don't need the extension. I don't know why they didn't give him a Hickman. Make this much easier for you. Nah. You won't have to do that.
Okay. At least there's this one is better than the yeah.
Much better.
Okay.
Okay. Now you can reach it with two hands.
Yeah, there.
Yeah.
Okay.
Clean it,
Clean
yeah.
this one.
Okay, yeah.
15
okay.
seconds.
15 seconds, okay. Yeah, better. Because if it, the one that would short, it's like difficult to like move around and
One-handed,
squeeze.
yeah.
Yeah. Yeah, Father, you do not touch the.
I did one.
He did good.
Okay.
Almost, but push in, twist close. Very good. That's good. You got it. Now,
Okay.
perfect. That's how you connect it. As soon as you connect it, I want you to open this clamp.
This one is open. This one.
See how it's
Open.
Yeah.
slide
Like this. It's
Yes,
not-
sir.
Yeah.
Perfect.
Mhm.
Don't forget that, or the pump will beat.
Oh.
Pump.
The pump will beat. We didn't even need that alcohol. You did good.
Mhm.
Always get 2 out just in case. Okay, very good.
Okay, very good.
So that's
That one
So-
is very is better. This one. For every change this one, change also this pump.
correct.
Mm.
Correct. Any questions so far?
No.
I'm just going to review. We took the medicine out of the refrigerator.
Mhm.
We checked the name.
Mm-hmm.
We got a new pump.
Yeah.
We opened the pump. Yellow key,
Yellow and blue.
blue key.
Yeah.
Close it, clamp it, clean with alcohol, put on the tubing, unclamp the clamp. That's all we've done. All right, now we're going to learn this pump. Well, we're going to learn what you need to learn. It looks, there we go. It looks intimidating with a lot of buttons,
Mhm.
but we're not going to use all those buttons.
Mm-hmm.
I like to say that we use the, or you're going to use the smiley face buttons. Just makes a smiley face.
Mm-hmm.
Okay. There is one button down here that says silence, the yellow one, in case it beeps and you need to make it be quiet. It'll make it be quiet for a minute or two. All right. So first we're going to do is turn it off and on.
This one.
Do you need
off,
more? Do you need more light?
off and on.
Yes, sir. You have enough light?
Yeah.
Okay. I'm just going to do this beeps and test. And it'll show the battery. The battery's in the back.
Yeah, battery.
Battery's about halfway.
Halfway.
So this may last a day or two.
Okay.
All right, the first option, it brings up 2 options, program and library. Program is always highlighted, the dark band,
Mm-hmm.
but that's the one we always want, so we're always going to choose that.
Mm-hmm.
So we're going to press enter or yes,
Mm-hmm.
which is there.
Enter.
Picture
Yes.
program niya. Yes, okay.
The next option, repeat the prescription
Mhm.
or new program.
Mm-hmm.
Well, if we change it to new program, it thinks you're about to change to, I don't know, pain medicine, antibiotic, whatever. We don't want to change it. So we just want to repeat the prescription.
Okay.
So it tells the pump that you're starting a new bag.
Mm-hmm.
Yes, enter.
Yes, but yes, Father. Istitang yes.
Yes.
Mm.
And now it's just going through all the settings,
Mm-hmm.
and you'll see 72 hours right there.
Mm-hmm.
The last one, it says press run to
Run.
start.
Mm-hmm.
No to review those settings, which
Mhm.
we don't need to review it because we're not going to change it. Options, I don't even remember what that does. We never use it.
Mhm.
Prime. Prime is to prime the fluid in here, but it's already primed, so we don't need to. So the only thing we have to do is run.
Run.
Do you see the run button? It's the
This one.
That's
run
right.
button.
You got it. And you started. How do you know
Now
you started?
confused.
This little green light flashes run.
Yeah.
Ah, okay. Yes. It's blinking. The run is blinking. Okay.
All right. Now let me show you a few things. Amount to be infused. 367 milliliters. Did you see that?
Mm-hmm.
Okay. Let's look at this bag. This bag says, all right, it says volume to be infused 367 milliliters. 367
Yeah.
point.
360 milliliters.
Total volume of the bag is 425 milliliters. So there's more volume than what the pump is going to infuse.
Mm-hmm.
So that means you have extra juice in here, right? How much extra juice? About 53 milliliters.
Yes.
50 millimeter.
Yeah, about 53 milliliters. Yeah. So, all right. So 53 milliliters extra. Okay. So let's go back to this pump. You see that rate? It said 5.1 milliliters. I'll show you again. Rate 5.1 milliliters per hour. So that's how fast this is going. 5.1 milliliters per hour. You have 50. What I say? 53.
Roughly
So,
50 something.
50 something
difference.
milliliters extra. So if you don't change this bag on Monday at, we'll say 6 o'clock, for whatever reason, it's okay. It's 53 milliliters of extra time in there. So 53 milliliters divided
Monday, you meant to say exchange this one Monday.
by about this
maybe.
time. Well, you can come to our office earlier than that. But 53 milliliters extra going at 5 milliliters an hour, that's 10 hours of overfill.
Okay.
So I just kind of want to show you that you have extra time. Not every bag is that way, but they always put overfill. Sometimes they do less, sometimes they do more. And so let's say you were coming to our office to change this bag at 2 o'clock. All right. And there's a wreck on the highway and you couldn't get there and you're 6 hours going to be late. Well, you still have 10 hours.
10
of it.
hours. Yeah.
You know, so
Okay.
that's
okay.
what I'm trying to show you is
Yes,
you have
yes,
extra
yeah.
time.
Yeah.
Does that make sense?
Yes.
Okay.
Mag-iilis pa tayo kailan tayo mag-iilis?
After 3 days lagi. Yan, ilan? I-record rin.
Okay. Okay.
So, meaning Father, so the difference sa 367 kaniba BTBI 425, the difference of that's your kanang muragapa extra
Gap.
time nimo
Extra time.
wherein you have to refill again.
Yeah.
So with the calculation, that's roughly mga dapat ay 10 hours to do the replacement.
Very good.
If I refill this bag, no need to stop this pump. Is already function.
So you don't refill the bag, you replace it with a new bag.
Yes.
Yeah, you press a new bag.
And then
If I change the new bag, this machine no need to stop.
oh, I see what you're saying.
Yeah.
So
Don, what you gonna try?
yes.
Yes.
Thank you.
Thank you. So if you need to replace the bag,
Yes.
yes, you need to stop the pump.
Yeah.
Yeah. So let's practice a little bit now.
Yeah.
Pause.
Pause.
So now you can pause it or you can turn it off.
Well, what is the?
There's no point, and the reason if we pause it, you're going to put this pump back in the box and get the new pump. Well, this pump is going to beep in there, so you want to turn it off. So let's practice that though. I want
Yeah,
you to
but-
I want you to
Check
see something new. So hold the on/off button.
Pause and on.
Yeah, we're going to turn it off. And now you get the new bag, the new pump,
New
and you
pump.
start over. You put
Start
this
over.
pump in the box, and then you'll change it again in 3 days.
Okay.
But now, let's say we had to stop this bag while it's running, or turn it off, or whatever, because you had to change shirts and you had to undo this. You know,
Yeah.
if you undo this, you don't want to just set it down.
Mm-hmm.
You know, the tubing, because it could get bacteria on
Yes,
it when it
yes.
hooks back up. You need to
You
put
have-
it.
need a cup.
You need a cap. Have you seen the caps? There's no caps in here. They're supposed to put them in here, but they always forget. But I'll get some from those girls. Well, there's a green cap, but I'll get a green cap and show you, okay? But let's say we just did that. We unhooked the tubing, we put the green cap on, now we can set the tubing down, change your shirts, take the tubing, take the cap off, clean with alcohol, put it back on. Now we're gonna start the pump back.
Yeah.
Do y'all follow me?
Yes.
So now let's turn the pump on.
Start the pump on.
There's one little change on this screen I want to show you. And I'll see if you remember most of it. Battery.
Okay. So Father, asa man ang pilion ana?
Program letter B.
Pwede turbi. Sa asa man na? So duha ka option, program or library. Asa man imong pilion?
What is the better this one? Program or library?
No, program.
Program. Always
Program,
program.
always
Oh,
program.
Library thinks you're going to change this the therapy. So always program. It will always be highlighted.
Always
So
program.
enter
Yes.
Yes, okay.
Now, this screen, do you remember? It was also two options:
Yeah, the
repeat,
and then you
or new program. But it's the same bag. We didn't change the bag, so we don't do repeat the prescription. We
No repeat.
resume this bag.
Yeah.
So that's one difference that you didn't see the first time. So yeah, we're resuming this bag. So yes, enter.
Resume this bag.
Resume
Press
this bag.
enter.
So enter, and then run.
Run.
Does that make sense?
Yes, yep.
Okay.
So the only time you may see it, the resume, is if you stop the bag
Yep.
sooner than when it ends.
Yep. Okay.
Let me get some
Okay.
green cap. You
Okay.
good with that?
Yes.
All right. Now I'm going to show you. Well, I'm just going to do this and you watch. This is your new purse, okay? And all this is you got to fight the Velcro. And the point of this is to put the pump in here so you can see it without opening the bag. So what I like to do is going to go like this. Let's see here. I try not to get it tangled here. All right, so I like to put the bag in here like it's hanging on a pole. So I use one of these, whether that clip or this. I like to use the Velcro. So I just put the Velcro in here, and I try to get it as tight as I can to the top of the bag. So now it's hanging, and then you kind of, what I call the bear hug. So you want to bear hug it. So it's in there nice and tight. You can. It doesn't fit very well, but there's another Velcro here if you want to latch that down. But you can see it kind of, it doesn't fit very well. It may or may not work. I usually leave it undone.
Yeah, so it's like free.
And then this, let's see. I want this to come out the top. I have to remember that. All right, on the pump, has a little pocket here. Let's see, let's do like this. It's a little tricky to try to get the tubing. See, it doesn't stretch very well, but when it closes, it will fit. The old pumps, the tubing came out on this side, so you didn't stretch it. This pump's different. Velcro, Velcro, Velcro. Now it's not going to go anywhere.
Yes.
I like to put the tubing that goes to you out the top here, and then I close it. Try not to. I don't want it. The trick is you don't want this to kink like a garden hose, you know. So you just kind of set it in here nicely, get nice curves. Here we go. Zip. And then the pump, or the tubing, I mean. Well, the tubing has a little notch to come out there.
Okay.
I don't like this piece hanging out because it catches on things. So I like to put it in here gently.
Go inside this one.
And then I zip it. That's just what I do. And then your straps.
Okay. So it's like you're going to school every day.
Imong gi-record pre.
Or shopping.
Or siya.
Imong gi-record.
Gani harapan doon.
Tapos magbutang tag kuan.
What's up?
Late,
Paminaw sa.
When you get up and go to the bathroom, don't forget,
Yes.
in the middle of the night. And you can put these straps anywhere. I think I've seen some people, you're small, you might even be able to put it around your waist, but you can do whatever you want with it. There's another hole here. You can change how your
But
tubing.
does it matter that this has to be like higher than okay?
Oh, good question. Yes, in a way it does. When, like, if you're sleeping, I don't want it below the level of the heart if you can help it. So if you're
Okay.
on the chair or the bed, I wouldn't put it on the floor because sometimes the blood will back up.
Yes,
into
yeah,
it.
yeah.
So
You
same
must-
It
level
has to
or
be
higher.
same level or above.
Same
Okay.
level or
So
little
it can lay in the
bit.
bed with you. That's okay. Yeah.
Okay.
But if you ever see blood running back in there, it's probably gotten too low. Just raise
have
it
to
up
raise
and
it.
it'll come back.
Okay. Okay.
You don't have to panic.
Okay. Okay.
What else? What else? The bag is yours. We don't need that bag. You can do whatever you want with it. The only thing one of the things I don't like about it, so you can see your pump, but you can't plug in that plug.
Yeah. Yep.
So if I were you, I cut a little hole here. That way you can plug that plug in.
No.
Does that make sense?
Okay.
So that you don't have to take it out.
Yes,
Because
yep,
you see,
yep,
it's a little bit of a work to take
Yeah.
it
Yeah.
out.
Yeah.
This one can make it a hole here.
Yeah,
a
yeah,
plug for AC.
Yes.
And AC you can plug there.
Correct. The bag is yours. You can do whatever.
But that is if the battery will drain and the other replacement will drain.
Yeah, if you don't have to use the. Some people like to preserve the batteries, and so they
okay.
plug it in when they go to bed,
Yeah,
or,
yeah.
or during the day when they sit somewhere, they plug it in.
Okay.
I had one patient; he never plugged it in. He said, and what he said was, he says one of the pumps, the batteries will last all 3 days for a bag. He says the other pump, the batteries would run out right before the
Oh,
3
yeah.
days was up,
Okay,
and he says I
okay.
had to change the batteries every time.
I see.
And I said, well, just plug it in. He says, oh, no, I'm not plugging it in.
Mm-hmm.
Well, okay, why are you complaining?
Okay.
So some pumps drain the batteries more than others. I don't know.
Yep,
which-
yep.
Maybe the age of the pump, I don't know. But
Yep. Okay.
your batteries are only half strength, so they may have run out in a day or two.
Okay.
But that's it. You good with that?
Yes.
You got my numbers if you have questions. Is this
Yes.
an iPhone?
This is recorded and this is iPad. Yeah.
If you have a question, the pump is doing something and you need to call me, you can call me, FaceTime, and show me the pump
Oh,
so I can
okay.
help you.
Yep. Yep.
Because
Yep.
it's hard to help people unless I can see the pump.
Yes. Yep. Yep.
If trying to think if there's anything else. I'm gonna tell you two alarm. You know, this pump can beep a lot. Did it beep a lot for you while you were here? This one doesn't usually beep a lot. But if it does, there's two beeps I want you to know about. If it beeps, you read the screen. One will say down occlusion. That is an occlusion in the tubing.
Close unit tubing.
So this is hooked up to you.
Mm-hmm.
Pump is beeping down occlusion.
Yes.
That means it's beeping from the pump to you. So somewhere is wrong with this, and maybe you forgot to open the clamp on the tubing. If it says up occlusion, it's from the pump to the bag.
Okay. Yep. Okay.
And that is probably has something to do with this little short tube. Yeah.
Maybe they have a squeeze.
Yeah, correct.
Yeah.
So you just, and once you fix the clamp or whatever's going, the pump just starts working again.
Okay,
You don't have to
okay.
push buttons.
Yeah, even.
So down and up further. So if it's up further, it has something to do with
it
here.
says
If
up
it's
occlusion,
down, that's below.
If it's
going to-
down, it's from the pump to him. Up occlusion is from the pump to the bag.
Yes. Okay.
Okay? And sometimes it's just this here.
Oh yeah, yeah, yeah.
As it runs out of juice, it usually gets better and fits better, but sometimes I think it's that.
Oh.
I don't
yeah.
think it fits. I mean, I haven't had many people tell me it's a problem, but every once in a while somebody will call.
Okay. Okay.
But once you fix that, it just starts working again.
Okay.
All right? You good with that? All right. Sorry it took so long. Busy day.
It's okay. So.
Oh, so I'll have somebody call you. Oh. What time would you want to come in on Monday?
I still have to check with.
If you can, okay.
Yeah, if we
I'll
can.
tell them to call you. Or,
Yep,
or
yep,
they can
yep.
text me and I can
Yep.
text you.
Yep. Mm-mm.
So you're not positive you can make it, maybe?
Yeah, we're not positive because actually the one who's picking us up right now, because of work, we might not be able to be here
Okay.
on Monday.
And if you think you can do it without coming in, you can do it on your own.
Oh, okay.
It's
Okay.
just in case you can't remember, more
Yep,
for
yep, yep.
reinforcement. If y'all want to try it on your own, I'm fine
Okay.
with that.
Okay. Yep.
But what's the date on this? 5/25. So they just changed. So that doesn't need to be changed until next week. Today's, what did we say today was 29?
29, I think.
4 days. 1, 2, 3. I mean, technically it needs to be changed on Monday or Tuesday. Yeah, that does need to be changed sometimes next week.
Okay.
Probably early in the week.
Well, I know, and when you say changing, like the
The
whole
dressing, not the
oh.
IV, just the dressing.
just
Take
the
that
dress.
off, clean
Okay.
it, put a new one on there.
Okay. Okay.
You can cover that up. I like to make it come out the top, out of the bag. Here we go. I'll let them know. Call to schedule. Alrighty, I'm free to let you go. I'll tell them. Call to schedule pump change for Monday, please. Which number should they call? What would be the best?
The one the one that I gave you, the one my sister texted.
That I've been texting you
Yep,
with?
yep,
Okay. 423 number.
Yeah, that one.
I'm gonna put they may be able to change the bag themselves, but the pig dressing is going to be changed. Okay.
Okay.
Don't forget those things.
Oh,
Yep.
Thank you.
thank you. very
Thank
much.
you. Thank you so much.
Thanks for
Thank
being
you.
here.
Thank you so much. It was
Well, what
thorough.
about this one?
Oh, I'll tell the nurses to take
No,
that
no,
off.
sana. Okay.
Go put that in the shower and burn it up.
Thank you. Really, thanks.
Oh, you're welcome. Oh, almost forgot. So, how we're doing? I know you're waiting on to get Medicaid insurance or
Ye-
something like that.
Yes.
Sometimes it takes a month or 3 months. So we got this paid for a month, 1 month. What I understand is the doctor was going to try to wean you off of this over that time. They've tried this before. Sometimes it works. Sometimes it doesn't. It just depends how you respond. If it doesn't work and you have to stay on this, then we have to do something. And we have to figure out how to pay for this. Whether we ask the hospital to cover another month, or your Medicaid becomes active. In that case, no problem. We just bill them. But that's the kind of stuff. Now, so my pharmacist, after a month, and she hasn't heard anything, she may start asking me, what's the plan for this? So I may reach out to you
Yes.
and say, what's the plan? Have you heard from the doctor?
Yep.
Are you going to wean off of this? Have you heard from Medicaid? That kind of stuff.
Okay.
So just be thinking about that. And we got 1 month to do this where it's paid for.
Yeah.
And then we
Okay.
have to think about what we're doing next. I trust you'll get the Medicaid, but I just don't know when. That's
Okay.
the problem. So we have to
Okay.
figure out how to pay for that until you get Medicaid, if you need that in the future.
Yeah.
Yeah.
Okay.
And it
Okay.
gets a little
So we'll just have
expensive.
to hear back from Dr. McCollum, right?
Either Dr. Ross or
Or,
Dr. Murphy, maybe.
okay,
The
okay.
cardiologist.
Okay.
One of those two.
Okay.
Dr. Murphy is the advanced heart failure doctor. Usually that's who follows for this. But I know you see Dr. Roth as well. You can see him as well. He can still assess you. But I
Yeah.
guess we would get our orders from Dr. Murphy. I'm not really
Yeah.
sure.
So if there's no like update from the Medicaid yet, they'll be like after a month they'll decide to wean off from that or to stay from. Okay.
I know we'll give you enough to at least go to a month, maybe even a day or two over. I don't know. Depends on how the bags work. But we just need to have an answer because I don't want you to run out. That's what I don't want to happen
Yeah.
out of medicine.
Curious question. What if like so there's no Medicaid feedback yet, and the 1 month is over.
And you still need it.
Yeah, and we still need it. So there's like what's the gap wherein he has to be in another medication? Like
Well, they don't. Usually, you don't want to be off of it very long.
okay.
So they did mention everybody. There's no specific answer to that. Everybody, like I've had some people off of this medication for an hour, and they become short of breath already.
Oh, okay.
I've had some of it off for 2 or 3 days, and it takes 2 or 3 days to become short of breath. So everybody's different.
Yeah. Okay.
It also depends how much fluid he has on him. You know, he looks really good to me. But everybody's different.
Yeah,
I don't know.
understand.
I don't have the
Agree.
answer to that.
Okay. Okay.
I was going to say something else about that. I mean, if you have to, you can come back to the hospital and we can figure it out again, you know, after 30 days if we need to. Because they
Okay.
did mention that,
Mm-mm.
just coming back to the hospital if he still needs it. But I don't know.
Okay.
I kind of wait for you and the doctors to
Okay.
decide that.
Okay.
All right? Just keep in
Yeah.
touch with your doctors.
Thank you. And we have your number also. We'll call you
Yeah,
if we
call
need
me if you
it.
need
Yeah.
time.
Thank you. Thank
Thank
you
you.
so much.
Thank
Thank
you
you.
so
We
much.
I'll
appreciate
tell the
it.
nurse come in here and take your IV out and pull your wires off.
Okay. Thank
Bye-bye.
you. Thank you.
Thank you.
Thank you.